Going in with MSF into this sort of disaster, the initial feeling is one of being overwhelmed by the extent of the devastation, and then fairly quickly the team starts to focus very much on what's immediately in front of us and the casualties that have come. There's often a feeling really of helplessness, of wanting to do more, sometimes frustrations that equipment and material haven't managed to reach us, sometimes difficult and upsetting procedures of amputations under local anesthetic because we've run out of anesthetic agents. And so the emotions and the feelings are very strong. At an individual level, the challenges are always dealing with these are brutal wounds. They were deeply infected after 3 or 4 days when people were still being brought out. The surgery isn't very complex, but it's a very almost primitive, brutal surgery of removing dead and damaged tissue and amputating limbs. And for us individually, it's always the different things, but for me, it's always the children. I think having to amputate limbs of children who've already been deeply traumatized by their experience is always hard to deal with. The decision you have to take surgically is whether you can preserve that limb or whether it is too damaged and the tissues are effectively dead and it must be removed. It can be a very difficult decision at times. The amputation is clearly the last resort you want to turn to, but where someone has been crushed for days in a building and the tissues have been severely damaged, then the great danger is overwhelming infection and septic shock setting in. So you're constantly looking carefully at the limb and trying to judge whether you can just remove a small area that's clearly severely damaged and protect the rest, or whether that damage is too severe. And that is a very difficult judgment to make sometimes. When we were working, it was pretty non-stop, and the first few days when we had so many casualties pouring in and when we were still having the aftershocks, we were working off 2 makeshift operating tables in the courtyard, and we just went from one patient to the next. We then did some resuscitation outside in the road and then came back in and went into the surgery. So it was a fairly continuous process. Coming back out now with the emergency team to a cold, snowy Europe feels almost surreal. And if one closes one's eyes, one can just see the pictures still in Haiti and the people there and their struggles to return to some sort of normality. But that won't happen for many, many years to come.